Me, I mean, I hated to see it, but I wasn't shocked by the disproportion.
When it comes to the impact of COVID-19 on different sectors of the population, certainly many of color have found themselves battling the virus and the residual effects. Reporter Lisa Smith looks at how the last year has impacted African Americans across the tri-state economically, mentally, and physically.
Donald Gazaway, an Army veteran and father of 4, was only 60 when he passed away in April. Odessa Williams was 82 when she died a month later. Just 2 examples of the COVID-19 victims we've covered in the last year. Victims who statistically are more likely to be Black.
Almost every person in our focus groups, as well as participating in the surveys, were able to say that they knew someone that had died from COVID-19.
Renee Mahaffey Harris with Center for Closing the Health Gap says the numbers show the devastating impact COVID-19 has had on the region's African American and Hispanic communities. They released this report in January. It says African Americans died at a disproportionately higher rate than other ethnic groups in Hamilton County. Also, 52% of African Americans knew someone who died of COVID-19. For Hispanics, it was 49%.
When you start laying all those predictive factors or determinative factors, and then you look at disease burden, that was consistent before COVID-19.
Their COVID-19 CommunityResources.com website has information about everything from videos to coping help, because they found the ripple effects of COVID are stressful.
That ability to work from home wasn't equal.
But the kids were learning at home, some didn't have online access for online learning, and jobs weren't reliable.
I think that for Black women in particular, there was an impact in loss of income.
Black businesses were disproportionately caught by the ripple effect too.
Those challenges showed where you were having trouble meeting payroll, having trouble paying back loans, for instance.
Eric Kearney with the Greater Cincinnati Northern Kentucky African American Chamber of Commerce estimates 25 to 30% of local Black businesses went out of business in the last year.
They would go in and get their taxes done once a year, but they didn't have somebody to do, let's say, quarterly statements or monthly statements, analyze them.
John Harmon and his wife print marketing materials, brochures, and booklets for clients locally and across the country. But business was cut off due to COVID.
No one was marketing.
Without business from large fundraisers, Harmon had to pivot to something people needed.
Some of our manufacturers switched to masks, so we started working with them.
Large mask orders and PPE kept him going.
Contacting our customers and saying, hey, masks are required now. Can we provide masks for you?
The businesses that survived are stronger, they're better, and they have proven to themselves and to the marketplace that they are survivors and that they offer value.
Lisa Smith, WCPO 9 News.
The Center for Closing the Health Gap has a hotline people can call for questions about COVID-19 resources. The number is 513-585-5879.